Now, since the beginning of the year, Europe has experienced a pretty big measles outbreak. About 3,500 cases have been reported in more than a dozen countries, and this is not even including the more than 5,000 cases and more than 24 deaths reported in Romania since January 2016. Well, joining me now to discuss the measles outbreak in Europe and some related topics is Eddy Rubin MD, PhD. Dr. Rubin is the scientific officer for Metabiota, a California-based provider of epidemic risk analytics. Dr. Rubin, welcome back to the show, sir.
Okay, good to be on the show, Robert.
Thank you, I appreciate it. And I always butcher the name of the company,
Right.
Metabiota. Is that right?
That was good. That was
okay.
Very good.
All right, excellent. All right. As you know, measles has hit the European continent pretty hard this year, and the U.S. CDC has actually issued several travel advisories. The U.S. Army is advising military families stationed there about measles. So what is your overview analysis of what is happening in Europe as far as measles?
Sure. Well, first of all, in the U.S., this is not the case. It's a rare disease. It's not endemic, but it's not the case in Europe. Multiple European countries over the last few years have noted marked spikes in the number of measles cases, and that's continuing. The places which have been most hit are Romania, which has more than 5,000 cases beginning in 2016, and Italy already this year has 2,300 cases. And so it's really, and we think that these numbers are really going to increase. And so I think the reason the number of measles cases in Europe is climbing is due to falling vaccination rates in some communities. And while I said earlier that it's not endemic in the U.S., we are also seeing localized measles outbreaks in pockets of undervaccinated individuals in the U.S. In fact, in the last 2 months, they've seen 63 cases in Minnesota alone. And so it's a problem. It's a big problem in Europe.
Right. And on the company website, it says that measles outbreaks highlight the classic spark and spread nature of infectious diseases. What does that mean?
Sure. And so, you can view the spread of many infectious diseases, such as measles, like the spread of a fire. The spark is the first introduction of an individual with the disease into a community. The spread is it spread to unvaccinated individuals in the community who catch the disease, in this case, measles. For example, in 2014, measles was brought to Disneyland by an individual. That was the spark. And from that spark, the virus spread to over 120 people in California and several other states. And so this represented the spread. This is all connected to the fact that measles is an incredibly contagious disease. If a person with measles comes into a room and sneezes and then leaves the room, and someone that is not vaccinated enters the room, say 2 hours later, that person can still catch measles.
Right.
And so it's really, that's the spark, and that's why the fire metaphor works well.
Yeah. On the website, there was a quote from you in one of the news releases, and it says, the current outbreak of measles in Europe highlights the need for countries to continue to understand their public health limitations and put in place proactive mitigation strategies. So I guess what I would ask you, Dr. Rubin, is how would you compare the proactive mitigation strategies to be done in, say, Romania, where the unvaccinated rate is like 96%, and in Italy, where they have this strong anti-vaccine movement, and even though and the health ministers actually recently come out and they're pushing for compulsory vaccinations in schools. And then there's Portugal, who only has a few dozen cases. However, they report about 95% compliance. So, how would you compare them?
Yeah, and so from my perspective, it's all about the level of vaccination in a country or a community. There is a safe and highly effective vaccine against measles, which is great. And if you're vaccinated, you have a 97% chance of never catching the disease. The vast majority of people that do catch the disease haven't been vaccinated. And so we see that when about 95% of a country or community are vaccinated, it really stops the spread of measles infections in the community. And so really there isn't a low level, there's not enough tinder around of unvaccinated people to keep the fire going. But in countries like Romania and Italy, for various reasons, in parts of these countries, they have much lower vaccination rates. And this is enough to sustain measles infections existing in the country. It's sort of like a smoldering fire, where it's smoldering and it's shooting out sparks. And so I think the places that are seeing problems, it's because for a variety of reasons, they don't have vaccination at an adequate level to put out that fire.
Okay. Now,
another point
sure.
is, I mentioned earlier about Minnesota, and this is a very interesting story in that the vast majority of individuals suffering the illness in Minnesota are Somali Americans.
Right.
And they're mostly children who haven't been vaccinated. And so it turns out that this community had a slightly increased rate of autism. Mm-hmm. And so it was targeted by anti-vaccination community. And so they came to this community and told parents that they vaccinate their kids, they're going to get autism. And so before the anti-vaccination misinformation campaign began, 95% of Somali American children have been immunized in this community. Following the anti-vaccination campaign, which began in 2008, now only about 41% are vaccinated. And so this unvaccinated community is sort of dry tinder for this and future measles outbreaks. And so it's really about vaccination.
Yeah, that's really unfortunate. Can I imagine it's probably very difficult to reverse that too, reverse the thinking.
Right,
yeah.
Right. No, it is. And there is no evidence, that has achieved any level of scientific credibility that say that vaccination is associated with these problems.
Right. All right. Well, on my website, outbreaknewstoday.com, I'm obviously covering outbreaks all over the planet. And at your business, Metabiota,
good.
I'm proud of myself there. You are clearly keeping an eye on hundreds of outbreaks going on around. Which outbreaks right now concern you most?
Right. So we do monitor about 100 events at any given time to advise our clients, because that's kind of our business. And personally, I'm keeping an eye on the recent Ebola outbreak in remote northern areas of Democratic Republic of Congo. Right. And the reason this is particularly has my eye is obviously due to the devastation that occurred with the 2014-2016 Ebola outbreak that occurred in West Africa. I think in the Congo there have been a little bit more than 20 suspected cases and 3 deaths so far, and it's been confirmed by DNA diagnosis, so they really do have it. But it's a very different story than what occurred in the West Africa, in that this is the more standard case. The Congo, for the past 40 years, have these very small outbreaks, and they're frequently isolated communities, and they disappear. They don't cause the problem that we saw in West Africa. And I think that's what's going on. Where it's occurring in the Congo now is a very isolated community. It's hard to get there. And also, I think we've learned a lot about responding to Ebola from the tragedy that occurred in the West African outbreak. And so I'm cautiously optimistic that with hard work, the outbreak can be contained. The other one that really has my interest is this H7N9 bird flu in China. We've been aware of this strain for a long time. It affects poultry. The virus jumps from poultry to poultry. Occasionally it will jump to humans. And when it jumps to humans, it's associated with very significant mortality. Fortunately, the virus doesn't jump from human to human, or at least it doesn't do that yet. And so that's good, but you always need to keep your eye on it, because if it did figure out the virus mutated and was able to jump to human, then there'd really be a problem, a threat similar to the 1918 Spanish flu pandemic. And so it's hard to know what will happen with either of these events, but they're both certainly worth monitoring.
Yeah, and both of the ones you mentioned are viral. Are there any bacterial outbreaks that concern you?
I think the really big one that is the multi-drug antimicrobial resistance.
Yeah.
I think that's something that's constant, and it's a big problem.
Yeah. Okay. And finally, Dr. Rubin, Metabiota is a partner in the global disease surveillance network called USAID PREDICT. Dr. Rubin, what is USAID PREDICT and how does it work?
Right. And so Metabiota has been a partner in this with the USAID, who run a pandemic threat program. And one of the programs in it is the USAID PREDICT. And this is a program, I think it's a visionary program that's looking for viruses in wildlife. We know that many of these outbreaks are viruses jumping from wildlife to humans. And so this program is really focused at, in an unbiased manner, looking at wildlife for the viruses they're carrying to see if we can begin to find the viruses that exist prior to jumping to humans. And so connected with that, our part of this program, we're operating a variety in multiple hot zone countries where this occurs, several countries in Asia, Laos, China, Indonesia. In addition, we're operating in Central and West Africa, Cote d'Ivoire, Sierra Leone, Guinea, Cameroon, Democratic Republic of Congo, and Republic of Congo. And in these countries where we help develop laboratories to do surveillance. We work with locals in both sampling and doing surveillance on animals. And this is both to look at animals as well as humans that have contact with. And the goal is to identify viruses with the potential to jump to humans before they make the jump. And so connected with this and other programs, Metabiota has a significant footprint in the hot zone regions of the world. And this contributes to us being tuned into when and where outbreaks are occurring, and sometimes both now and thinking about what might happen in the future.
Very interesting. All right. Well, thank you, Dr. Edward Rubin, for your time and expertise once again, sir. Thank you.
Okay. Take care, Robert.
You too. Bye-bye.